talk about musculoskeletal disorders. So what is wrong with our current path of treatments for MSDs, and why are disability rates so high, increasing?
Now, this is what I talk about every day. And I tell everybody, we are in the midst of a musculoskeletal epidemic. 1 in 2 Americans have a musculoskeletal problem that we all know. It's costing $213 billion a year. And I'm constantly posting on social media, the trends are going up. Our patients are getting more and more disabled. They require more and more care, more and more surgeries, more and more MRIs. We're making it worse. We're not making it better. With all of our advancements in technology and health, we're destroying musculoskeletal problems. So what is the cause? And research has told us, if you look at the research, where do you get good outcomes? It's the passive care. So the more we do to a patient to get that's passive, the sicker they get. And that starts out with an MRI. You know, I always say the MRI is the greatest sales funnel. You get an MRI, your chances, and I would love to see this research. If you get an MRI, your chances of having surgery go through the roof. And I preach to employers, my patient gets an MRI, I need an additional 8 visits just to talk them off the cliff, because the MRI is going to show them something's wrong. And all the McKenzie clinicians out there know that I'm 51. So my MRI of any joint is going to show all kinds of stuff. But unfortunately, we don't even have the cause of the problem. So if I have back pain, I go in, I'm 51, I have an 80% chance of degenerative disc disease, 80% chance of multiple bulging, but maybe I have cancer that's referred. They're going to look at my MRI and they're going to treat me based on that diagnosis. And unfortunately, that's what we see with our results. Patients, rotator cuff tear is a big diagnosis, a big surgery. And our internal numbers, I'm trying to get this together to put some research out. There was a recent study that said that 42% of the time, that isolated extremity symptoms are referred from the spine. So we need to clear that spine. Unfortunately, that doesn't happen unless you have a select clinician that knows to do that. Our internal numbers with rotator cuff tear is 50% of the time not is much higher than 42. That diagnosis was flipped to cervical. And then that's 50% of them. And then the other majority of rotator cuff tears end up being, derangements. So yes, it shows up on an MRI, and we can't go down that path of just treating by a picture. So the musculoskeletal epidemic, the more passive care we give, the more you need me to fix you, the sicker that patient gets. We're putting in their head that they are sick, there's a problem, they have a herniated disc, for the rest of their life they're disabled. That's what we have to get away from.